Peña. I'm the committee chairperson for Health and Human Service. Introductions, moving forward.
My name is Catherine Chamorro. I'm a board member.
I'm Marcelo Villagran, board member, Lincoln Hospital Public Affairs.
Jose Quintana, New York City Department of Health and Mental Hygiene.
Hello, everyone. My name is Jonathan Siriaco. I am the mediator and outreach coordinator for the IMCR, as the Institute for Mediation and Conflict Resolution. So my first meeting here, trying to get acquainted.
Herbert Quinones, Department of Health, outreach, the Community Syringe Litter Program.
Hi, everyone. Kenneth Johnson, Health Department, Community Affairs.
Hi, good evening, everyone. I'm Anita Reyes. I'm the Assistant Commissioner for the Bureau of the Bronx Neighborhood Health, part of the Health Department.
Welcome.
Good evening, Madam Chair, ladies and gentlemen. Anthony Jordan, District Manager to the Board. Just for a reminder, our meeting is being broadcast live on our YouTube channel. And if you're speaking for the first time, for our honor, who is replicating the one's voice in the minutes, please say your name for the first time when speaking so that the audience can recognize your voice. I'm joined by my colleague, Diana Leonard.
Okay, we're gonna go ahead and thank you guys so much for coming. We're gonna start off with Kenneth Johnson for Community Affairs for his presentation.
Yes, thank you. So I'm joined by my colleague Herbert. We wanted to take some time to talk about some of our harm reduction strategies citywide. We have a few updates and some data to share about our community syringe redemption program. And with that, I'll turn it over to Herbert.
Okay, so thank you so much for inviting us. So usually, right, the first question people ask, what's the Department of Health doing? Right, valid question. Consequently, here's our response. Next slide, please. So to date, folks, this is what we've done thus far, okay? Through today, if you will. We have some syringe service programs that collect syringes, as well as, we also, right, so we coordinate with the Department of Parks as well as the agencies of the community service organizations that we fund, the syringe service programs. In addition, and the big one, the new addition is the one to your far right, we are going to, we did a soft rollout, for a syringe redemption program. Think about gun buyback program, same concept, except this time syringes. We offer 10 cents per syringe, a maximum of $10 per person. They are trained on how to secure the syringes and where to bring them, okay? We are gonna be running our mobile unit from Cortland and 148th Street. And technically, we've already been there. Again, we did a soft rollout, but officially July 1st will be the hard rollout. So it's 10 cents per syringe for a total of $10 per day. And they get trained on how to collect the syringes safely, as well as carry naloxone. Folks, by show of hands, how many folks are familiar with naloxone? Yeah, right? The medication that reverses the effects of overdoses caused by the consumption of opioids. And so, we just want to be clear that we have been aware of this problem, of this challenge, if you will, and we've been addressing it through, the collecting of syringes through our syringe service programs, and then the hard rollout of our community syringe redemption program. And we hope at the end of the day that we make an impact, that there will be, I think you have a copy of the slides just in case.
No. Yeah.
So the main thing is know that we are aware, these are the things that we've done so far. And we hope to continue to make an impact, and let the community know that we are trying to be responsive to the challenge of syringes in our communities. And just to put a personal touch, just a personal connection. I live in El Barrio, and so this is my community too, and many of us feel that way. We are New Yorkers, many of us born and raised, and many of us, folks that came from other cities to study here and ended up getting a job with us and are committed to these kinds of things. Because at the end of the day, all of these things are important, particularly in the context of quality of life. And so here we are. If you have any questions, we'd be more than happy to address them for you. If we don't have the answer, we'll get back to you as soon as possible. Yeah, right. So just to break down, the outreach syringe litter teams are part of the syringe service programs. So just to put everything in context, right? Because people ask, well, why is the Department of Health giving us syringes? HIV, Hep C, right? Our responsibility is to prevent the spread of infectious diseases to the best of our ability, citywide and regardless of people's behavior. And so we know that there are folks who, for whatever reason, choose to consume their product of choice via syringes. And so we're there to provide them clean syringes, again, to prevent the spread or exposure of HIV and Hep C. Unfortunately, one of the unintended consequences is that, similar to people who own dogs who don't clean up after them, people that use a syringe sometimes will just throw it in the street. So we have our syringe litter programs out of the syringe service program that have some OSL teams. And as I keep referring to the community service, the syringe redemption program. And in many parks throughout the city, particularly in the Bronx, let me focus on that. We have some syringe kiosks where people, if they choose to consume in the park, can then, dispense of their needles through the kiosks that are located in parks like St. Mary's and other places throughout the borough of the Bronx. Particularly focus on those areas with a lot of, traffic around consumption and unfortunately, the consequent littering of syringes. So with that being said, I don't know, here's the flyer for the syringe redemption program. Please feel free to make copies and share with, folks throughout the community. Please take one and pass the rest. The QR code will identify where we are, when we are, when we're gonna be there. And again, it's an opportunity for folks to, contribute to helping us address this issue and walk away with a couple of chelitos, in the context of an incentive.
Thank you so much.
There's another clip.
Yeah, right. So, this is, Department of Health, we're big on putting stuff in context and quantifying our stuff with data. But again, and you have a copy of the slides.
Yeah.
So, at the expense of not being redundant, because I know there are other things that the community board has to address.
Well, this is the main one.
Oh, okay.
Yeah. This is something that everyone in the community has concerns about. And so, is there any other presentation or just this one?
Is this one?
Just this one? All right, so.
Yeah, so we're here for the duration.
Yeah, can we open the floor for some questions? All right.
I don't know, you guys know.
Yeah, and by-
more.
Yeah, I mean, that's okay.
And
I'd
by
rather you go back to one of the beginning slides and just address where we are. That one right here, this is the
Yeah.
more
And
important.
by any chance, are there any questions online?
None, Chair.
Okay, all right.
Oh, okay.
So, yes, thank you so much for that presentation. I have a couple of follow-up questions in regards to, the mobile unit.
Yes,
You said that it's a soft opening and you guys are starting in July.
right. So
What's
just to
the,
be clear, we're talking about the syringe redemption program, right?
Yeah,
Because
the
we have
syringe.
mobile units from the syringe.
right,
Yeah,
the
yeah.
syringe,
Okay.
yeah. So, what's that vision look like? Like what are the location within the area?
Okay,
What's
so
the stop?
specifically here, Cortland and 148th Street, corner of. And then, so folks, the
Okay.
idea is, folks can come through, drop off their syringes, and we give them, again, 10 cents per for a maximum of 10 syringes per
Got
day.
it, and what's the hours?
Oh, man, you know what? I'm gonna defer to the QR code,
Okay,
but it's hours that, because we've done the research, we're big on that complement the community of folks who are consuming.
okay.
Yeah, so I think, I think we might be here early morning,
Yeah, I think so.
right?
Yeah.
Yeah,
So there are two sites in this district, at the hub and then also at St. Mary's Park. They're there from either they spend an hour at each location, so either 8 to 10 for both locations or 7 to 9, one combination of the two.
And those are the only two locations that you guys are open to thus far?
in the South Bronx.
In this
In the South
district.
Bronx.
Yes.
Yes.
So if I was to propose additional sites, what would that look like? Because we do have 138th and Grand Concourse. We do have 138th and Park Ave, where there's a lot of syringes. We do have Pulaski Park, by Bruckner. The list can continue,
Mhm.
it goes on and on, yeah,
Right.
Westchester and Brook. And so my thing is like, are we able to give you guys some kind of a map of pinpointing where these syringes that are being dumped? I am a part of a community where we're trying to open a dog park because there's a lot of poops in the area, so we're trying to clean the poops.
Right.
And so having to clean a park where we find 200, 300, syringes being dumped and no one knows where it's coming from and it's a constant thing. I want to be able to have those type of conversations with you guys on what that looks like, because it's not just those 2 points that you guys mentioned. It's also around schools.
Yes.
the area. And so as a parent who is, to a mother of a 10-year-old, those are one of my biggest concerns, walking in a park and seeing syringes.
Right.
So I just wanted to just give you guys like an open mind of
Mm-hmm.
not just having those two sites. I know the St. Mary's is huge, and it has been one of the biggest problems thus far in terms of the syringe collection. But I just want you guys to be really mindful of other, locations in the Bronx. And if we can have a conversation further, I'll be open for that as well. Are you guys meeting with?
Can I add a
yeah.
comment? So I mean, we're, if you have any suggestions for future locations, we can definitely take those. I can't make any promises, of course.
Yeah, sure.
The thing is that this is just a pilot, so this is the guaranteed contract for 1 year only.
Okay.
And the funding, the locations were set and they were determined by, some of the data that we get about syringe complaints. But it's also a citywide initiative, right? So that's why we have multiple sites in multiple boroughs. With that being said, if all goes well, I'm sure, at the end of this, there will be another opportunity to give feedback on, other sites that we could expand to.
For sure.
And just let me piggyback, because I was focusing on the South Bronx, because we're here. So just to be clear, when it comes to the Bronx, though, we're also at, like St. Mary's, Echo Park,
Okay.
Walter Gladwin,
Okay.
that's off of the Cross Bronx. But now,
I'm familiar with the entire
Right,
Bronx.
and
I got a lot of offices in
and
the Bronx.
right, and up in Kingsbridge.
Okay. Nice.
Okay?
All right. Yeah.
Yeah,
Especially Kingsbridge. We
Right.
have, and then also Burnside. I mean, I don't know if you guys pass around Burnside. I have 7 offices throughout the Bronx, and I've seen a lot of dumpage
right.
of syringes. So I just want to make sure. I hope this can expand, and I'm so happy that this is a pilot. It's not here to attack or just make negative comments. It's just an eye opener of what this is. This is a big deal. And so we want to make sure that we could be able to support you guys in any way that we can. My next follow-up question is, are you guys meeting with NYPD for any, case scenarios or anything in regards to what this pilot is gonna?
Are you aware?
So not in terms of this pilot specifically,
Yeah.
we're not really collaborating with NYPD.
Okay.
We do have other initiatives, like Community Link that was in the hub that, we often collaborate with the police department on. But for this pilot specifically,
Yeah.
it's a.
Because the new precinct is right across the street.
Yeah,
Right.
but because the location of St. Mary's and the reputation of St. Mary's, a number of our syringe service programs do service that area.
Yeah.
And I'm sure NYPD is familiar with.
Yeah.
I would be perfectly candid to say our relationship with Parks and Rec is probably more substantive
Okay.
because the workers are there on a regular basis.
Right.
So they have been trained, how to be mindful and letting us know, and the syringe service programs know about the syringe litter issue.
Okay. And I know I'm asking so many questions.
No, listen, this is why we're here, so please
I know, right?
do not qualify your,
Yeah. So in terms of the mobile unit, how many staff are you guys gonna have on site for that particular unit?
Okay, so again, the syringe redemption.
Yeah, syringe redemption. We're
Yes.
back at that. Yeah.
So currently, we have about, I think, between 4 and 6 staff, depending on the day.
Okay.
And, so let's say between 4 and 6.
Is it full time, right?
Well, full-time in the context of the time that they're
That
here.
they're here, right?
Yes.
Correct. I just want you to clarify for
Right.
live,
Yes, that's what I keep forgetting.
Yeah. It's not just me.
Right.
We're on live.
Yeah,
And
So in terms of the schedule, right? So we have they make stops at every location, every pilot location. And like I said before, they're there for an hour. So we're looking at, I think, about from 6 a.m. to
Nice.
1 p.m., something like that. And this is citywide, so it takes time. We have to account for travel time and commuting. There is one of the locations is in Jamaica. Another one is in I think Bushwick. Yeah, Bushwick
Yeah.
area. So we do have to just to let them drive and get to their locations. But they're on site I think 4 or 5 days a week.
Okay.
So and
Alright.
you'll see them. And if people, it's open to the public, enrollment is, and so if people are interested in getting involved, if they see the band, they can go up and just
That
let
was
them
my
know.
next question,
Yeah, let them know
yes.
that they're interested and we can enroll people
Yes.
as they come.
Now, in regards to the map of the kiosk, I know you guys mentioned you guys have some in St. Mary's.
Yes.
What's the collection of that on a monthly, weekly basis? Do you guys make repairs? Because I've gotten some feedbacks that a lot of those kiosks were not in
in good shape.
in good shape. So that's my main focus, and I want to be able to be mindful to open to the community, because that's a lot of the complaints that we're getting with the community, especially with our general board meetings.
Right. So this is one of those little tricky dances because it's us and Parks and Rec. So I know we focus on collecting the syringes.
Got it.
I will be more mindful, Kenneth, I'll be more mindful of addressing the maintenance
Okay.
of the kiosks.
And maybe that's why we want to make sure that we can try to figure out how we can be able to make that happen.
Yeah.
All right. So, because it's important, we want to make sure that you guys are picking it up, but also
Right.
the maintenance of it
Yes.
is still standing. And
Yeah. So we don't definitely want to get into a pointing fingers like, well,
no,
it's
for
not
sure, for
right.
sure.
So in the spirit of we focus on syringes, and then we will work on the maintenance piece to the best of our ability. Is there any way of sharing the flyer online with the folks who might be watching on YouTube,
Sure.
so that they,
yes,
they can access the QR code?
Yeah, for sure.
You know, to get a sense
We'll
of.
definitely post that, right? Okay, cool.
Yeah, cool.
Um,
And again, I also want to be clear that it's not just the syringe redemption program, the syringe service programs, again, they have the outreach syringe
Right.
little teams. So it's not just one unit, it's multiple,
yeah.
but the syringe redemption program is a pilot initiative, and their focus is strictly on collecting the syringes
Collecting.
and providing a financial incentive.
Okay.
Yeah.
I have no further questions. I know I'm gonna pass it to my members. And if I have any other questions, I'm sure the people on live might have some questions. So I just want to be mindful that it's just some concerns that they have, and so I'm gonna pass it over. Go ahead, Christine.
Oh,
You got
thank
it.
Thank you.
Introduce yourself so because we're on live.
And I apologize for being late. And if this was already discussed, again, my apologies. But I'm wondering, with the incentives to participate, when it says, $10 a day for bringing used syringes, in this neighborhood, that's a big deal, right? So, even bottle collecting is like it's really important, right? So because it offers another aspect of having an income. But when it comes to needles, there's so much danger involved. What is being done when you're saying to the incentive program, you can bring us needles, but I really don't want to see my local community members just picking needles up like crazy, like, like willy-nilly picking up
Yeah.
needles, because there's so much danger involved. Like, what is the process of someone understanding that
Right.
part of this incentive is they can't just pick up needles with their hands?
Yes.
There's specialized gloves. So could you speak to that?
Right. So let's be very clear to all our people out there.
Yes.
Do not pick up the needles
Exactly.
until, and here's the little wrinkle, and my apologies if I wasn't thorough. You come to the unit, we will train you on how to pick up the syringes, what to be mindful of, what kind of things you need, okay? And then after that is when we would hope that people bring the syringes in, and the little, we call them the little black canisters that people can use for personal consumption, for their personal syringes. So again, do not touch a syringe right now. Hey,
But
just
I
let us
think that
know.
really needs
but-
to be clarified.
Yes.
Because you could say the incentive is only based upon a training or no incentive
Right.
will be given, because it offers an incentive that could be potentially dangerous.
Right, so if everybody can indulge me and just refer to the flyer real quick.
Yes.
I think the third paragraph, you must be 18 or older to take part in the program. Sign up at a syringe redemption location. When signing up, you will be trained on program goals, rules, and other details, as well as how to handle syringes, report injuries, and use naloxone. And
I think it
naloxone
needs
is
to
the
be like a big
medication.
thing, like, do not pick up needles
Right.
yourself.
Right. So I understand what she's saying. Like,
Yeah.
if you guys have like a clamp or something instead of a hand, because the community is gonna have some concerns. But I do agree with that.
Yes.
What does that training process looks like? What's the time frame? Is it like one day? Is it like a week?
We, in the spirit of, we live in a short attention span
Yeah.
culture now,
Yeah.
no more than 15 minutes.
Okay.
Yeah, because you got, so we sign you in, we register you, and then we do the training, and then, people are encouraged to then go ahead and pick up the syringes safely.
And I would add that you can't participate in the program without being enrolled. So say someone, worst case scenario, someone does collect syringes without being properly trained, they wouldn't be able to participate and receive the incentive because they're not enrolled in the program.
Okay.
So just another way to incentivize that people do actually receive the proper training, so that they can, handle the syringes safely.
Okay.
Again, I think that needs to be really, really put in big letters, because $10 a day is a big deal, right? It can make a difference, and we wouldn't want people just saying like, okay, I didn't understand that part, and maybe even risking themselves by picking up needles and not even knowing how to put them.
So you have 20 cents. Is it 20
Yeah,
cents or 10
you know what,
cents?
can we just tease this out a little bit? Because
Yes,
I
because it's
come from-
important.
I'm at the Department of Health, but I come from community activism, so let's
Yeah.
keep it real. right? People that listen to us, oh, 10 pesos, $10.
Yeah.
If you're gonna do it without getting the training right now, please use tongs and put them in a detergent bottle. You know, the hard
Yeah.
plastic Tide bottle, just to keep it real. All right, just to be,
Yeah,
you know.
because it's money, right?
Exactly. Now, just to connect with kind of said, you won't get the $10 if we don't train you and we don't register you.
Right.
But in the spirit of being community minded and just helping clean up syringes, if you want to take the initiative, again, we prefer we train you.
Right.
But if you're gonna do it, a pair of tongs, so don't touch the syringes and put them in a detergent bottle or, you know, some kind of hard plastic container. All right, just from the spirit of being community minded. After we train you and we register you is when you can definitely get the financial incentive. You know, but you know how it is, we're
Yeah, and that's
talking
why I
and.
feel like it needs to be really
Right,
big.
yeah, so
Even
we'll
though
take
this
that
is
note
beautifully
back.
designed, like, just something that you will not be given
Yes.
this incentive without a training, do not pick up needles on your own.
Right. Right, so again, yes,
For
do
your own
not,
safety.
right, please, right, let's be very clear. Do not do it until we train you. All right.
Thank you.
Yes, no, thank you, perfect.
Any other questions?
Yes,
If I may, I pulled up I did the QR code thing. I saw that you're about at least 5 sites in the Bronx.
Yes.
A couple in Brooklyn, a couple in Harlem.
Right.
How many, I'm not sure if you mentioned, how many mobile units are there for the New York City, for the Community Syringe Redemption Program? Is it
Right, so
just
again,
one in the
exactly.
pilot?
yeah, just
One
one,
in the pilot
one
for
mobile
now.
unit for the pilot, yes. But then to be clear, right, we have our traditional funded syringe service programs that do this on a regular basis. But to get the incentive, you gotta go through the syringe redemption program. So use that QR code, everybody. Okay, thank you.
Just to share a little bit of background surrounding the syringe redemption program specifically. So the organization that we partnered with, they are the same organization that facilitated a similar program in Boston. So this was the first of its kind a few years ago, and it had really positive results. And so, you know, we've gotten questions before about why we didn't partner with a local organization to do this pilot. And the reason was that we wanted to have an organization with a proven track record of doing this at a large scale. And then some neighborhoods in Boston, syringe complaints or syringe litter complaints were reduced by as much as 50%. Obviously, you know, New York is bigger than Boston's, you know, demographics are you know, different. But, you know, we think that that's very promising. So that was one of the reasons why we chose this organization.
Thank you so much. Any other questions? Yep. Yep.
Thank you, Chair. So thank you first to Ken for putting together your leadership and being the person to answer a lot of the hard questions for the community board. And thank you, Commissioner, for your lifelong work and making sure that public health is a major part of every day what you focus on in your team at the Department of Health, especially for our borough, as we work together to try to make the Bronx to turn around so many negative health and social conditions that have impacted our community and especially our district. And as you know, Chairperson Pena and other committee chairs have been studying this issue around open drug use for a considerable part of this term of the community board, given the fact about how has been impacting our district. As you may know, the Department of Health, deputy mayors, so many folks have been visiting and touring different parts of the district, especially what you see when you come out into the hub. And unfortunately, what's happening at the Borough Clemente Plaza and trying to understand and reimagine what can happen in that space. That's such a beautiful space. And to look at also so many of the other health conditions that have exacerbated after COVID, diabetes, heart disease, cancers, et cetera, et cetera. So this committee under Chairperson Pena has been focusing on that. But the fear of the growing of those health issues, but of course what the open drug use is sending us back into looking at the South Bronx almost back to the 80s and how we have to be able to dig deep and sometimes think out of the box about how we're going to think of innovative ideas to resolve this issue. So our committee has been working steadfast with our elected officials in the state as we look at OASIS and the State Department of Health and their role and understanding how harm reduction and other contracts that help to work with our brothers and sisters who are battling methadone and other drug addictions and those who are, and how the city is working on this and its harm reduction contracts as we work to combat all the harmful diseases that can be connected to syringe usage. what are some of the things besides this pilot program? And Deputy Speaker Ayala, thank you for and the council for putting the money behind this thing. What are some of the initiatives is the department looking at now or pipeline that's going to be addressing this issue specifically, or the other issues that you are working on every day in the health department?
Yeah, I think I'm gonna turn it over to Kenneth and Herbert, who are really focused on the Bureau of Alcohol and Drugs,
Sure.
so that they can talk about what they're doing.
Right, in addition to, right, so we offer naloxone trainings. So just to be clear for the folks who are out there, naloxone is the medication also known as Narcan. There's a new phrase now, Narcanning somebody. What people mean by that is that this medication can reverse the effects of an overdose induced by the consumption of opioids. It's an opioid-specific kind of medication that reverses the effects, all right? What we tell people, though, because people say, well, Herbert, I don't know what that person took. I just saw them splayed out. When in doubt, administer the naloxone. If the person did not consume an opioid, we do no harm. And if you don't feel comfortable, please call an ambulance, okay? So there's that, and so we do trainings as well as.
I want to
Yeah.
question right there real quick, because sometimes people who use Narcan, I just want to make sure it's a safety aspect to it.
Yes.
Because if you give someone who's addicted and you Narcan them, you likely can become a public safety issue. So.
Could you extrapolate by the public safety issue?
So someone could be really pissed off if you mess up their high.
Fair enough,
by
fair enough.
Narcan.
Yes.
And we have had folks who have Narcan trained in our shelter systems and everything else. So I want to say that it's a good program to save life. That's
Right.
the primary focus using Narcan. But has the department looked at how people should be, like what steps they should take to ensure that their safety is also intact while administering Narcan?
Right, so let's be perfectly candid, okay? Again, like I said, I come from community
Right.
activism.
So both do, yeah.
Right, so let's be perfectly candid, right? We want to save someone's life. And the challenge is that the person who's overdosing does not know that they overdosed,
Sure.
right? The last thing they remember is consuming. And so the way I designed the training is that when the person responds to the naloxone, we ask the person doing the gesture, if they feel comfortable, introduce themselves. So, hola, my name is Herbert. You were overdosing. I administered Narcan and I called for an ambulance. How the person responds to receiving the medication is very challenging. So at the end of the day, if you don't feel comfortable administering the Narcan, please call an ambulance. So, what I tell the people when I train them, I said, don't feel pressure to carry the naloxone because you can still save someone's life by just calling an ambulance. Because at the end of the day, when you decide or you make the choice to save someone's life, unfortunately, there is the possibility of someone responding, in an unpleasant manner. Now, if you'll indulge me further, because now I'm in my trainer mode, if we save 10 people with naloxone, maybe one of them may respond in an aggressive manner. Let's just hope it's not the first person, right?
Right.
So do know that there are, some unintended consequences when trying to save someone's life. The flip side, and I don't mean to be, somewhat irreverent, but in order to be pissed off, you got to be alive. So but then again, I do this work so I can roll with that. Someone gets mad at me, you messed up my whatever. I can roll with that because I know at the end of the day, in order for you to be angry, you must be with us. But it's a valid question. And so at the end of the day, it is a decision people take on. Are you willing to be a good Samaritan, but be mindful that by this gesture of being a good Samaritan and saving someone's life, they may not initially be very appreciative of what transpired.
May I share? I have another
Yeah,
question.
go ahead.
What's your suite number? And this is what I mean by suite number. We already see that at the pilot, we're at 94,000 plus.
Right. So we're going back to the syringe redemption program. Right? Notice I just want to keep clarity.
My mind is.
That's okay.
And I appreciate that you're bringing that out of
Yes.
us. So 94,000 plus the suite number that I'm sure that there's some folks, a number of people who are crunching that we are projected to reach X amount, where a trigger will be thrown to say we need to expand this and to other communities to help the issue, because you're balancing maybe how many overdose, how many syringes are collected by the health department, how many are collected by sanitation, how many people are going into the
Syringe redemption program. Right.
So what is the suite number for us that we should, if we, like the chair talked about once, to say we should go to this community, that community, that community, because this can also help with positively by preventing accidental punctures or it to be in a different place or that it doesn't be, and it helps to make sure that this program is definitely successful. What's the
Okay,
department looking at? How will this grow in the next 3 months to 6 months?
okay,
What's
so,
the
Yeah, you just gave them a bunch of questions.
right.
Hold
So,
on.
in,
Let's
right, so in the
dissect.
spirit of being clear, I'm gonna paraphrase. So what's our sweet number as far as, did we meet our goal of collecting a certain amount of syringes? Is that what we're talking about?
Did you say, wow, this is going great, like faster than we thought?
Mhm.
This is gonna projected to be this big in 3 months or 6 months. We need to think about other sites because this is showing to be positively to be reproduced in other
Right,
places.
right. Excellent question. Do you have a number?
No, I mean, as far as I know, we don't have a number.
Right.
I know that, again, like this is a pilot. I mean, we're making really good progress, as you all can see from the data. I think honestly more than I thought that we would collect in this time. And granted, these are split between several sites, but I think monthly, just in St. Mary's Park alone, which is probably one of the higher places for syringe litter, the Parks Department collects around a little less than 2,000 syringes per month. It can fluctuate with the temperature. And so, so when we think about, I mean, that's a significant amount what we've collected so far, even though it's citywide. And a majority of the sites are in the Bronx. I would say that, in terms of expansion, obviously, we have constraints, mainly the budget, but also political will. I think that's another thing that's out of the department's control that, we have to really kind of evaluate and think about, what our city council's priorities are, and some of our other local elected officials, because this was the only reason why we're doing this pilot is because it was passed by the council.
Right.
And it's only a 1-year pilot, right? So.
And why is it capped at $10?
Obviously, I think a lot of that has to do with the budget, right? We want to make sure we have enough to go around, which kind of connects back to the original question, what's our goal?
Yeah.
At the end of the day, as long as the money's there, we're going to continue to do it.
I'm getting like nonstop like text messages, so I'm gonna.
Wonderful.
Yeah. So I want to give you guys one of the concerns.
Uh-huh.
So, say you have somebody from Roberto Clemente who's a user.
Yes.
And they go and sign up.
Yes.
Right. I guess the question or the concern is having them collect the needles to exchange for money to then consume drugs.
Yes.
Like what's your take on that? Like, is that something that you guys are considering a possibility of seeing or?
Yes. And again, in the spirit of being perfectly candid, we understand, right? That, if the people who are bringing the syringes happen to also be consumers, this may very well, fund their next consumption. Right?
Are you guys?
I just want to counter that by saying that this is a safe way of making some money versus unsafe ways of making money, stuff that may put the community at risk. You know where I'm going with this, right?
Absolutely.
Yeah. And so, right. So the idea is this A, reduce the syringe litter, and B, allow people to make a couple of coins to take care of self, if in fact that's where they are, without, impinging their needs on the community by soliciting in the street, et cetera, et cetera.
Yeah, I think that's gonna be a huge concern from the community, especially with the amount of traffic that we've been witnessing.
Right.
Unfortunately, the hub has a lot of schools, charter schools, public schools, businesses, and so it's a huge concern. It's something that I think the community is gonna question, and is it gonna be positive feedback? I'm not sure, but I'm all in support with the pilot. I just want you guys to be mindful of what that's gonna look like.
Right.
Yeah.
And again, the key word is pilot, right? We're trying this out. Maybe in 6 months we can come back and give a more comprehensive report about, there's been less solicitation in the street, less syringes, which is our clear-cut initial goal, and things of that nature.
And then my follow-up question, because it goes based on the case scenario at the time of day. If that potential Jane Doe comes in to enroll and you know physically, on appearance wise, that person is not well.
Right.
Is that something that you guys will consider to not enroll that person?
Excellent question. The answer is technically yes, right? Because if they can't, right, we don't want anybody to put themselves at risk.
Right.
Let's just be perfectly candid,
Yeah,
right?
I just want you to be very clear for the live, because I don't want you guys to get attacked.
Yes, that's okay. And again, this is why we're here, right? To speak to the community through you, right? So yes, I mean, there are certain assessments that we make in the moment, So if the person is technically, someone who can't care for self at that particular time, we may very well ask them, excuse me, Doña, maybe come back next week?
So pick up allá,
Yeah, on a case-by-case basis to the best of our ability.
Yeah,
But to be candid, right, this is a pilot, we're gonna see how it goes, but our intentions are a lot more positive. Reduce the syringe litter, and hopefully the $10 incentive will be something that people can manage, to take care of themselves. But let's be perfectly candid, taking care of self can also mean I can get something to eat now.
yeah.
I can go to Mickey D's and get me,
No, absolutely.
to
I
the
just
muffins
want you
and the
guys
coffee.
to, be mindful about that too,
Yeah.
It's just, it's what we see on a day to day.
Mm-hmm,
And we, again, I'm sure the community, everyone's gonna be in support because it is a pilot and we wanna make sure that this can expand to other areas of the Bronx.
mm-hmm.
But it's also just being mindful of what that looks like. Are you guys gonna provide some type of referrals or
Yes,
some type of, care incentive or program referrals, anything in regards to what that enrollee person is going through?
so
You
the
know?
answer is yes to that, right? So again, let's be clear, right? Person X comes through, they're not feeling well, they're not looking well, we can engage in a conversation about self-care. And
Okay,
if that conversation leads to them going, you know what, I've been thinking about rehab, I've been thinking about detox,
Yeah.
we will make those referrals. So that will happen
Okay.
in the spirit of what we're piloting.
Maybe this is a good segue if you want to talk a little bit about the OSL teams and some of their operations.
Right, so the outreach syringe litter teams, again, they go out and they address the issues of syringe litter and the identified locations, like we talked about Kingsbridge,
Yeah.
St. Mary's Park, et cetera. And they're also able to make referrals because they come from the syringe service programs, so they can refer folks to detox and rehab.
okay,
So yeah,
yeah.
I have one last
Yeah,
question.
sure.
Please.
Go ahead, you go.
All right. For the purpose of the recording, my name is Jonathan Siriaco. In the spirit of how this will look like, how long would it take if somebody brings the syringe? How long would it take for you guys to take it and then compensate them?
Mhm.
I'm just thinking about if 100 people show up at the same time, would that be a long line in the street outside? Would that be inside of a facility? How does that look
okay.
like?
The
And the
transaction,
timing,
what that transaction
Right.
looks like.
Right,
Yeah.
from point of contact for them getting their money, on average, 5 to 10 minutes, depending on the number of syringes, because we do count the syringes.
Right,
We have to count them because it's 10 cents per,
yeah.
all right, and maxes out at $10, whatever that number is, real quick.
Is it 100?
I think so, yeah, something like that, along
Which I
those
mean,
lines.
that's a
Right.
lot of syringes,
That's a
right?
lot.
Like,
Yeah.
I don't imagine someone bringing in that many.
I
at
do,
one
because
time.
we had
Yeah,
a
but they might-
a pickup and it was so devastating. We collected about 300
Okay,
and we had to I didn't do that, but we had experts and people who were well trained to pick that, and it was a
Mhm.
good 400 for
Okay.
that just little small batch.
right,
So-
so, right, depending on the number of syringes, and we do try, try to manage
Yeah.
the population and let them know, what's going on, keep them, it's gonna take 10 minutes, it's gonna take 5 minutes. Also, let's factor in someone who wants to be trained, that's gonna take a little longer,
Right.
right? Because we go over the safety standards and we also talk about them, encouraging them to consider carrying the lock zone. So it can be fluid, but on average, my whole manual, let's say 5 to 10 minutes,
Okay.
okay? Yeah.
All right. Well, I'm yeah.
I have one more question, please. You have a question.
Yes,
Please.
yes, quickly. I think it's the same, we're focused on the same way, synergies collected. So you mentioned you don't have any data, right? Monthly, daily data about your mobile units is collecting, or just, you mentioned that Corland in 140 A Street, because last weekend I saw the mobile unit.
Uh-huh.
So my question is to see the statistic numbers just per month, how many times the mobile unit is located in that place, how many times we be collecting
Mhm.
just monthly or daily. So
Okay.
because you give me a total number, 90,000 plus, that means a daily, weekly, or monthly.
Valid question, yes.
Yeah, so the
So-
statistics we need.
I don't want to sound like I'm copping out here, but it's very fluid, right? Because the
Yeah.
person may bring just one syringe. So that's something I think we can provide you by the end of the week
Yeah.
to let you know what the breakdown, because that's what you're asking for, right?
Yeah.
What's the breakdown per location? If not on a daily basis, certainly maybe weekly or at least monthly.
Yeah.
Okay, and then we can extrapolate the daily numbers, if you will, from the gross numbers. So that is something we can provide you.
Okay.
But let's be fair now. 94,000 since January.
That's
to June in 6 months, anybody do the calculation real quick? That's a substantive number,
Yeah,
right?
yeah.
Yeah, there's gonna be,
Almost
also gonna be an
20,000.
idea about like, remember we have like a methadone
From March.
programs
March.
just around in these areas.
Right.
That means maybe it's collecting more like a needles.
Okay, so it's March.
But we need those comparisons between those places that we
That
have
was the
to
sophomore.
figure out like
Right.
which one they were collecting more like than other ones.
Mhm.
Oh, thank you. Yeah.
The chair, so all the numbers are calculating for this to January to May? All these
No,
numbers?
no, this says March.
It says March.
March.
March,
That's
so
what it says,
March
from
to
March.
May, this for both ground syringes,
Just syringe redemption
this
programs.
is not all of it.
Yeah, the rest of them are from January.
So
January
we're
2020.
close to, this is rounding up to almost 1 million
Yes,
Wow.
At some
altogether.
point.
This in a small period of time,
right,
and once in a small part of one borough.
right. But hold on, let's just clarification. So the 94,000, that's just from the syringe redemption program, which began in January.
For
Right.
the
The
Bronx.
other numbers,
For the Bronx.
well, let's say collectively for
Okay,
right now,
yeah.
okay? Because we didn't anticipate,
Yeah,
you know,
yeah,
getting into the,
Yeah.
into
I mean,
the
we're live. I
minutia.
just want you to
Yeah,
clarify.
no, keep it live, estamos vivos. So 94,000 since January of 2025 through
Sure.
June. Maybe somebody out there can do the math for us and
To break it
text
down,
us.
what's
Right.
the
The other numbers are from January 2020 through May of 2020, March 2025.
Right.
Or something like that, right?
Citywide.
Yes. Okay.
So all of those numbers are citywide.
Yes.
So
Yeah.
even citywide, we're heading towards 1 million of
Yeah.
folks who are using, give or take, of a syringe usage is, and I did the math,
Uh-huh.
not that the math you actually do, I cheated one of the other way.
That's okay.
So a little over 900,000.
Okay.
965,000.
Since 2020, right? Which is because you're looking at the other categories, but
Right, right.
Okay.
Still, and so my thing is, where do we, and this is probably a science number, where do we say epidemic, pandemic, or what do we reach those? Like I said, the numbers are saying we thinking that this is definitely a health. Well, I know that you think it's a health emergency. That's what the Department of Health is working on it.
yes.
What do we say that we have to go into our? Let's use a doctor bag. We have the we're gonna probably do first aid to now we got to go to emergency disaster relief kind of like stuff. When do we put out the bigger dogs or solutions to deal with this issue?
Wow. Well, technically, the syringe redemption program is a response to that.
Yeah.
I'm not saying
Yeah.
it's not, but what I'm saying what are bigger things that do we cap how many
Right.
more programs new open up? Because I know that the state licenses facilities, but the city determines where they go in communities.
Okay.
So
So this sounds like an infrastructure question,
so
right?
when do we say we need to we need to be innovative
Uh-huh.
about how we are doing this program, because some things feed a program, and I'm just trying to play devil's advocate, feeds into
Right.
a problem, and some things work to resolve problems in a real big way. So I'm saying, when does the department say we need to throw a switch a different kind of way to make sure that, do we want to clean it up? Do we want to minimize it by pushing people to go towards methadone programs, or do we want to push people towards 12-step recovery?
Right.
What are we thinking innovatively as a department to say this is how we need to now probably address this issue? Because if we can, because maybe this is it.
Right.
I'm asking you, is this our magic trick out of the bag
Right.
solution?
To piggyback on your right now, this is our latest rabbit out of the hat is the syringe redemption program, right? Because let's be fair, right? Since 2020, we've been looking at this issue,
Yeah.
and it continues to be a challenge, right?
Mhm.
Despite the fact that we've collected all these 900,000 syringes collectively since 2020, we're sitting here because it's still an issue.
Right.
So the latest thing we came up with is, okay, why don't we try a buyback program like we've done with with guns,
Mhm.
and see where that takes us as far as making an impact. All right, but folks, let's be perfectly candid in the spirit of public health. As long as people continue to consume, we're always going to be challenged with something.
Right.
In this case, it's manifested
Yeah.
in the context of syringes, right? It also manifested in the unfortunate number of unintentional fatal overdoses, which led us to now incorporate the addition of naloxone. So we are adapting to the best of our ability. But get back to the key answer is the syringe redemption program is our latest attempt to address this challenging issue.
But that's addressing, and Chair, I'll finish with this.
Mhm.
In my opinion, it's probably not. That's addressing the cleanup
Mhm.
When do we deal with the addiction? You know,
Yes.
the chair had an opportunity to have a group that was here that did a study on the potency of the drugs that are being sold
Yes.
in our community versus other communities.
Uh-huh.
80% more potency or addictive than it is.
Right.
And I'm assuming it's not being made here.
Mhm.
It could be, we have some very
Yeah.
smart people are here.
Right.
So that's what I'm saying, that you're doing your part, and there's something is maybe a public safety part, and some things are part of the other part. But how do we say to police department or state or federal, we need to figure out some way, because we can't keep up with the deaths, and we can't keep up with the needles that are coming into our community.
Right.
So that's what I'm asking about the rabbit in the hat. What do we ring the bell to
Right.
say that this is an issue, and it's proven by the addiction rate, the syringes that are cleaned up, to all the things that we are doing to try to mitigate this issue.
Right.
I agree, we should help our brothers and sisters wherever they are.
Yes.
How many resources we are. I'm not negating that fact. There are a lot of them are in my family.
Right.
And so I'm just saying, what are we thinking about, or how can we, like the chair said, be helpful to advocate on a real aggressive side, either elected officials
Mhm.
or to other folks to say, we need more tools in our bag to be able to work on this, because if not, we're gonna continue to reinvent this problem.
Right.
It's not gonna go away.
Okay.
And I'll stop with that. Thank you, Chair.
Yeah.
I'm going to say this at the risk of my commissioner and my colleague being here. The fundamental question, folks, because we grapple with this, we are the, if you will, the drug unit, the Bureau of Alcohol, Drug Use Prevention, et cetera, et cetera. The fundamental question, my people, becomes, what is it about the human experience that people choose to change how they feel?
Mm.
What is it about that?
Mm.
Because that's where it begins,
Yeah.
right? And so back into my trainer hat,
Yeah.
right? People consume for various reasons, right? To feel better, to feel good.
To be able to
And
know all
so
that.
a cultural question that I pose in my trainings is, does our country promote substance use?
Oh.
And I think we can all say the answer is yes, right? Cinco de Mayo. How many Americans know what Cinco de Mayo is?
Right.
Right? But we know about tequila shots and margaritas,
Yeah.
right? Memorial Day, I don't know what's coming up. July 4th, right? You come to my house for a barbecue, I better have what? Y'all can answer out there in the public sphere.
Right.
So one of the challenges is, why do human beings, why has the human species has always looked for a way to change how they feel, separate from a medical issue, right? I got hurt, this is what the doctor prescribed me. So what is it about that particular dynamic? Because it goes back to the issue of, if you will, addiction, for lack of a better term,
Yeah.
Sure.
right? Because nobody starts out having a substance use disorder issue. It's a gradual progression. Right? I start off Friday night every 2 weeks. I'm a city worker. I get my paycheck. I'm gonna do a little yayo,
Mhm.
right? Because I'm gonna treat myself, and that unfortunately can devolve into a substance use disorder.
Yeah.
So that's I think a question that we've been struggling with millennia, certainly since the war on drugs began. That we obviously have come to terms with the fact that we're not winning.
Yeah.
But what can we do? Harm reduction is obviously, we meet people where they are, keep them safe and healthy until they're ready to make a different lifestyle choice. Right? Give them the options of when they're ready for detox and rehab. Because we've learned that if we impose that, right, that does not work. That does not work. Even when people choose to stop consuming, it's a challenge, right? We have a word called relapse, right? That identifies the fact that I can stop consuming for 6 months and then something happens, I'm having an issue with my landlord, right? And I'm pissed, and then you know what, I'm gonna go do me.
Mhm.
And so it's a bigger challenge, but I think hopefully we're on the right road and meeting people where they are and giving them the options of, hey, stay safe. And if you choose to, go to detox or rehab, here are the resources we have for you. Sorry, I don't have a more magical
No,
answer.
I just want to add that the city has created a plan. So there's this mental health plan, and it talks about the reduction of drugs, and we should look at it just so that you can see exactly what's being proposed. But like the number one thing is like reducing like the deaths, right? Like number of people that are dying for that. But there are other strategies as well. So I do recommend that like when you get a chance just to look at the plan.
Mhm.
It's called a Care Community Action. And it's a mental health plan for New York City that has the strategies that we're thinking of. To your point, Mr. Jordan, is like, what are we doing? We've been thinking about this. There's a plan out there, and there's more that we could probably do. But I think that we also need the help of the community to kind of inform us. You've raised good questions in terms of like, have we thought about this or that? And so how are we elevating those points, right? And so my office is a local office. We're working together with different key stakeholders to see how we could really work together to address some of the things that are happening. So I just wanted to add that. also just being mindful of, the team, the bureau that's really focused on this work on a daily basis.
Thank you so much. Because we're live, I just
Yeah.
want to make sure you guys clarify as much as you can
Yes,
today.
yes.
I do appreciate you guys for coming in to present and taking the time, because this is very important. This is something that I am passionate about. This is why I am chair for the Health and Human Service Committee, and we have to listen to the community.
Yes.
And we want to make sure we support the community in all aspects, whether it is schools, businesses, and just people's well-being. We really care about that. So thank you so much.
No, thank you for inviting us.
Do you have any questions? All right, we're good. I think we're
Thank you
good.
so much.
Yeah, no, thank you.
We don't have any other old businesses, right?
Any questions online for us, from the people?
Do you want to check? Oh, Diana? No, nothing. Okay, good. So we're good. And so,
I want to add though, Chair, thank you, that the board stays ready to be used as a space for trainings as you do NAPSA
Right.
training, or you want to do the hazard material trainings. The space is a space that we want to tell under the chair to say that the community will love to start. And I think I talked to Kenneth about this, is that we want to make sure that this space is also our ability
it's
as
open to the community for that, yeah.
do those trainings. So we love to set, especially when we're on board meeting break during the summer, for this space to be used as an opportunity to help be able to be a resource as we begin to make healthier Bronx, healthier South
Well,
Bronx.
you just said that to the wrong brother, baby. So let me say this, for our people in the community.
Okay, I'm passionate.
We can do naloxone training, it's an hour-long training,
Yeah.
en inglés y español. Podemos hacer la presentación en español y inglés
Yeah,
sobre cómo administrar naloxona.
perfect.
So we can do that if you allow us to, do
Yeah,
it
for
here.
sure. I think that's the focus. I think that we want the community to actually, be a part of whatever trainings that's available. Yes.
We also have mental health. We were doing the mental health first aid, but we heard from the community, those are very long trainings, so we've cut it down. It's like a 3-hour training that really could help the community members in terms of identifying like what's happening, how resources that there are in the community, and how you yourself can help someone who's going through a crisis.
Okay.
So I think there's opportunities. We're also working on chronic
Is that
disease.
free?
It's all free.
Okay,
Right?
all right, I gotta make sure.
Well, your tax
Relax,
dollars at work.
relax.
Your tax dollars at work.
So I want to say that all the programs that we offer are free from the health department, and we are also focusing on chronic disease. I also heard Mr. Jordan say, there's
Yeah.
other conditions that we're worried about. So diabetes is one. We're working very closely with Lincoln Hospital to offer one-to-one trainings and things like that on how to self-manage diabetes, but we're also looking at asthma and the conditions that we're seeing in these communities. So there's a lot of different health issues, and I would love to think about ways that maybe we could activate the space to offer the community more opportunities to learn about the illness, how to manage it. So I think this is a good start to this
We could
conversation.
definitely open the space and then also put something together to post it too, because we're in a different time and social media is where it's at. And so we want to be able to support you guys so that you guys can be able to educate the community the best way you can.
Yes, I would like to mention something, Anita, is regarding I think it was 2 months ago, the ECHO Hospital collaboration with the Department of Health. The event was asthma event at Lincoln Hospital. I think it was great. I spoke with the administration and also Lara, who is the assistant, and they mentioned that they would like to continue.
Yes.
Yeah, providing those kind of events in the lobby, and they like it. They absolutely, the community received too many resources.
I would love to continue, to
Yes.
see how we could do that. And I think what we were doing is tabling at Lincoln Hospital
Correct.
to offer the community the services that we have. And one of the services for asthma is that we're seeing the apartment buildings having a lot of rodents and pests. And so we're able to send a pest management company to do an integrated pest management for kids under the age of 18 who are living with pests or rodents and have asthma, right? Because we know that that's a trigger. So we would love to do that. And also if there's families in the areas that are needing resources and support, we are working with a couple of partners in the community that are offering case management. And we're in the works of also working with clinical partners to see, do a quality improvement to see what's going on and how we could help the providers, the families to get the resources that they need to manage their kids' asthma. Because no child should be dying from asthma in the Bronx, and we are having kids dying from asthma. It's a preventable disease, right? So how can we work together? So very happy to hear that Lincoln would like to continue the partnership.
Yes, that's our CEOs you
And
mentioned.
we're also placing some community health workers in the ER, in the emergency room, because we're hearing that the emergency room, we're seeing parents come into the emergency room, and sometimes they don't have a pediatrician or a primary care, so they're using the ER. Every time their asthma flares up, they go straight to the ER. So we're trying to get community health workers, 2 of them, I think they'll be starting very soon, in the ER, and they're gonna be working like from 8 in the morning to 9 at night, on Mondays through Saturdays, to make sure we're identifying those families that need the support.
Exactly.
So, really
And
excited.
by the way, like I would like to mention something like the next Tuesday, the 26th, we'll have the Pride event.
Okay.
I would like to know like from the Department of Health, can you tell me like which department is like, they have the Pride department?
Yes.
It can be part of our event.
Yes,
Next
definitely.
Tuesday.
If you email me,
Yes.
I will make sure that someone from my team from here in the Bronx is in attendance. But we also have our colleagues from disease control, communicable disease, and I think they would be happy to come out and distribute prophylactics and other things.
That's good.
Can I just piggyback on that, since
Yeah.
we're talking about Pride events?
Yeah.
So, this Saturday is the Bronx Pride, here in the South Bronx.
Yeah.
Guess who's gonna be here dispensing naloxone? Aquí estoy!
Yeah.
So just know that, so this Saturday, if anybody wants to come through, look for our table, we'll have our banner.
Where
Department
at,
of
for
Health.
the sake of life?
I think 3rd Avenue and 149th Street,
All right,
right?
perfect.
On the corner.
Westchester.
Westchester between 30 and Brook Avenue.
Ahí está, yes.
Okay,
All
perfect.
right, so just in the spirit of the trainings and stuff, this Saturday we'll be here, and then I guess we'll collaborate,
Yeah. And yeah, we're gonna be there too. They've asked us to come out and offer some support.
Right.
We're gonna be there.
All right, I think that is,
So what are the ages for the trainings at the Naxon training, so that the chair is aware? So if you're interested in joining our training here,
Uh-huh.
what are the age limitations for Naxon and then so has it?
Okay, so here's the thing. If a person can understand, right, what naloxone is and can follow all the steps to respond to an overdose, age is negotiable. And I'll give you an example. I did a training where a father brought a 10-year-old. Why? Because daddy has a back injury and is on prescribed fentanyl. And the son had already saved his life. Before naloxone was nasal spray, it was intramuscular. And the son had already saved his life with the syringe. So he brought the 10-year-old to learn how to do the nasal spray. So again, but it's on a case-by-case basis. We talk with the individuals to make sure that they understand what's going on. Because at the end of the day, we want people, like our commissioner said, no one needs to die from asthma and no one needs to die from an accidental overdose. So we take that on a case-by-case basis.
So we're happy to come and do these trainings. We also have, it's called a community mental wellness and resilience training. I'm happy to kind of coordinate to see how many we could do here, maybe a couple of them during the summertime, one in July, one in August, and then also try to do the naloxone. And so we have a lot of trainers at the health department. In my office, we have a few trainers that are doing it out of 1826. So if somebody walks in and they want to get trained, we train them like in 5 to 10 minutes, and then we give them the naloxone. So you don't have to like wait for a training.
1826 Fulton?
Arthur Avenue, Arthur.
Right.
And we're there like from 8 to 5, Monday through Friday, and that's what we want. We want to make sure people also know of a place that they can go and just pick it up. And we're also working, I think, with different, pharmacies and other places in the area businesses so that they could be equipped as well with naloxone.
Yeah, so just to connect the dots, you can also go to your local pharmacy and see if they dispense naloxone. Okay?
okay.
So you don't, just us. It's a community, right? It takes a village.
Yeah.
And make it readily available for everyone.
And we have a map of all of the participating pharmacies on our health map, which I can share with you
Yeah.
afterwards.
Hi, Jose Quintana, DOH. Kenneth, those participating pharmacies, are they charging for the naloxone or are they giving it?
That is
It
a
should be
good
free. I
question.
think
Yeah,
it should be
should be. It should be
It is free?
Yeah.
Because I'm one of the trainers at our office
Okay.
on Arthur Avenue. And we ask folks, if you need to replace or if you've used it, because it's expired or what have you, please come back to us because we'll give it for free. But just as a trainer, it's great to know that the pharmacies are now offering them free of charge if they are doing that. And it would be great if we were able to have a list of pharmacies that are actively providing them free of charge so that we can share that with people whom we train or just in general for the community.
Fair
Yeah,
enough.
and then I would add to that, that the New York State Health Department has, programs where they can ship, naloxone, they ship testing strips, other kind of like drug safety related resources as well. So I can share that with you all as well.
And just a personal story, I just
Right.
visited a friend in the hospital at Lenox Hill, and she had surgery, so of course they're putting her on some heavy drugs, and as I'm leaving, the walks in the pharmacist and brings them naloxone.
Wow, all right.
So that the family could know
Yeah.
that she's getting some heavy dose. Anyway, I thought that was amazing just to see, like, right,
Yeah.
the pharmacist coming in and equipping us all with like what she needs in case she goes into an overdose. So I just want to say there's a lot of efforts being done to make sure that people have the tools at their site instead of having to go,
Yeah,
elsewhere.
that's really good to know.
Yep.
That's really good.
Teamwork makes the dream work.
Yes. Thank you so much. Okay. Any,
No, none.
none, okay. All right, so we adjourn this meeting. Thank you guys.
Caso cerrado.
Yeah, thank you so much. I would like to take a picture, if that's okay?
Yeah.
This is our first time
Whatever.
opening the office. Yeah, this one.
That's great.
Oh, this
Yeah,